our Pharma Talk session focused on continuous glucose monitoring, also known as CGM. My name is Katie Lockman, and I am an account manager for the Diabetes Engagement Services at McKesson. It's my pleasure to introduce you to our session's sponsor, Dexcom, and our speaker, Andrew. I will turn it over to you.
Thank you very much. All right, good afternoon, everybody. It's good to see everybody. I hope everyone's having a great conference so far. I am Andrew Cox. I'm a pharmacist by training, and I work as a senior manager in medical affairs at Dexcom. So I focus on value and evidence generation for healthcare payers like pharmacy benefit managers and national Medicaid programs, and we aim to ensure that their clinical criteria coverage is aligned with their most recent ADA, AAC guidelines, and that sort of thing. So that's generally my focus. So today, what I would like to do is talk about how we design the CGM for simplicity, and how that leads to better patient adherence, better patient health outcomes, and also healthcare cost savings in terms of emergency department visits and diabetes-related hospitalizations. Throughout this presentation, I'll talk about some CGM G7 features. I'll talk about our upcoming launch of our 15-day sensor for the G7. I'll speak to some real-world evidence that supports the use of CGM in diabetes care model and care management. And then lastly, I'll have a slide that has a bunch of pharmacists and healthcare provider resources that you all can access online that you can use for your patients and better serve your patients and understand how CGM fits in the diabetes care model. So, legal disclaimer. We put this presentation together. So the G7 CGM is engineered both to be innovative, patient-friendly, safe, and also a great way to monitor glucose levels throughout the day. And as you can see, there's a handful of features here that are so critical to CGM involvement in improving patient outcomes. Perhaps the most important is the accuracy. There is a specific term called mean absolute relative difference, which is MARD, and that is the gold standard by which a CGM is measured in terms of accuracy. Our current G7 has a MARD of 8.1, and you say, well, what does that mean? And essentially what it means is if you were to compare the CGM data against reference data, say a blood draw, the glucose levels would be within 8% of what the blood shows. So the more accurate a CGM, the more confidence a patient and provider have in the CGM data. The provider has a better way of tailoring the therapeutic regimens and the diabetic medications to the patient because of the accuracy of the CGM. We also have real-time and retrospective glucose information on our G7 app and also on our Clarity app, and those can be found in the App Store, and I'll talk more about those in the upcoming slide. We have actionable alerts. We have alerts for high glucose, low glucose. We have urgent low soon, which is a predictive, almost artificial intelligence type alert, and then we have a delayed onset alert, which I'll discuss more in the next slide. Our G7 connects digitally with a lot of the AID systems, both the Tandem's products, Omnipod, and the Beta Bionics Pancreas, and also the Tempo pen as well. And we'll talk about that in a later slide. We have no limitations on pregnancy. The FDA has approved our CGM to be used in pregnancy to monitor for gestational diabetes. I've tried on the G7 a couple times. It's painless. You put it right on the back of your arm. Very easy to apply. It's a lot of fun to use to see how your body responds to certain things. I have a big sweet tooth, So to see how my body responds to cinnamon rolls is quite the eye-opening experience. So, and only a 30-minute warm-up, where other CGM sensors take an hour. This one takes 30 minutes. It's applied, 30-minute warm-up. You start to get real-time glucose readings every 5 minutes sent to your smartphone or receiver. So these are the alerts and then the real-time monitoring I was mentioning before. The predictive hypoglycemia alert we call the urgent low soon. This predictive alert will tell the user within 20 minutes if they're headed for a hypoglycemic level below 55 milligrams per deciliter. So they have 20 minutes, the user has 20 minutes to adjust, maybe take a glucose tab, and prevent hypoglycemia. And as you can see, this predictive alert has led to a 33% to 40% decrease in hypoglycemia among users. We've also had a significant decline in rebound hyperglycemia, so the users are not overcompensating when they see the hypoglycemia or experience it. We have a delayed onset hyperglycemia alert, and we have it delayed because of two reasons. One, insulin stacking, so a person with diabetes will have a meal, and if they get the alert, they might inject insulin too fast and too much insulin and then cause a hypoglycemic event. So we delay the alert. The user can adjust the alert settings from 15 minutes to 4 hours after they've eaten, and they can respond accordingly based on their levels with how much insulin they want to use. We also want to reduce alert fatigue. I know I get tired of notifications on my phone. I'm sure the user gets tired of all the alerts on the CGM. So all alerts with this Dexcom G7 are customizable, and it really has been a benefit clinically for people with diabetes, both type 1 and type 2, using insulin. On the software side, we have Dexcom Share and Follow. This is an app you can also get from the App Store. And the patients can share their glucose values with their family, anyone in their network, and with the prescribers, or even pharmacists at their local pharmacy. And it actually has worked out really well and made people more actionable and accountable to their diabetes care. And as you can see, reduced diabetes distress, so reduced anxiety and depression from having diabetes, because you get the sense that a team is around you supporting you in your diabetes care. A1C improvement in 47% of the users, and over 62% of users reported fewer episodes of severe hypoglycemia. And that's just from getting everybody involved in your care, should you want to share that data with them. Lastly, our Clarity app, which is ranked #1 by US endocrinologists. This app is geared towards clinicians to help clinicians see in real time and retrospectively how their patients are managing their glucose, what is their time in range, how many hypoglycemic episodes are they having, how many hyperglycemic episodes are they having, what dosage adjustments need to be made, what insulin adjustments need to be made. And as you can see from research, 55% higher retention than those who don't engage with Clarity. So patients who engage with Clarity are way more involved in their self-diabetes care and with their endocrinologist. And the highly engaged patients had 16% greater time in range relative to non-users. What does that mean? For every 10% increase in time in range, it roughly equals about a 1% decrease in A1C. So the more you can be within homeostasis, time and range, over time, your A1C starts to go down. You get below the goal of 7, and you're not poorly controlled anymore. So the ultimate goal is to have continually time and range, and these apps help and empower the patient to do that. And we also took a survey, and 96% of patients said the CGM system was easy to use. So, like I said, very, very easy. So now we're coming out with a 15 15 and a half day sensor. And this will come out probably in the fall. And this will be the longest lasting CGM sensor on the market. Each patient will have 2 sensors per month, so that's 1 less per month. And this will be a 50% increase in wear time over the current G7. And a lot of our patients requested this update, so we decided to do it. And because there's fewer sensor replacements, research has shown that there's better adherence to the CGM technology because you only have to replace the sensor twice a month. And lastly, going back to the accuracy, we've improved upon the accuracy. The 10 and a half day was 8.1 for adults, and it's 8.0 for the 15 day. So better accuracy across all glucose ranges, and this is all supported by randomized controlled trials, retrospective analysis, and we're really excited for the 15 day. So I know the patients are too. So what does the G7 look like with automated insulin delivery? As you can see here, we have triple Bluetooth connectivity, so you can connect to your Apple Watch, your phone, and you can also connect to your AID system, whether you're using Tandem, Omnipod, or Beta Bionics. And within that, you can use the share and follow. You don't need any finger sticks with CGM. Finger sticks are almost a thing of the past. And you get all the alerts. One endeavor we're undertaking is we're integrating the data with Epic electronic health records. So now the hospitals who use Epic can follow the patients. Any primary care endocrinologist office that uses Epic can link up Epic with Clarity in our cloud to get that patient data. So now it's all streamlined with Epic. And then we have other options, if there's optional calibration feature to help provide added confidence in the data that the user's seeing. We also have a ton of digital health apps that we connect to. If you wear an Oura ring, we have a partnership with Oura as well. So you can see glucose readings if you have a CGM and an Oura ring. So there's a lot going on here with the AID systems, but the accuracy is the big thing for both pediatrics and adults. So let's shift gears here and go to the economics. So I said that CGM helps reduce healthcare spending and diabetes care. This is a retrospective observational study that examined claims data from the Aetna claims database of commercial and Medicare Advantage beneficiaries. What's important to note is there's 4 diabetes populations here. You have type 1 diabetes, type 2 with intensive insulin therapy, so that's bolus and basal. You have type 2 diabetes, non-intensive insulin therapy, so that's just basal insulin. And then you have type 2 non-intensive, no insulin therapy, so oral medications. And what you can see here are pretty significant drops or decreases in the amount of diabetes-related ED visits, hospital admissions, or ED visits due to diabetic ketoacidosis. And then over here, across the 4 populations, you can see that the change in diabetes-related hospital admissions, based on the claims analysis, drops significantly. So just by incorporating CGM, not only do you get glycemic control and you get better clinical outcomes at the population level, you get subsequent healthcare resource utilization decreases, you get less medical spend, and you keep people out of the hospital. And a lot of that ties back to time and range and just how interconnected the patient is with the prescriber through the apps and taking ownership of their diabetes care. So don't act surprised that you're seeing a GLP-1 slide on a diabetes presentation. You can't escape it. But we ran an internal retrospective observational claims analysis a few years ago, and we looked at A1C across GLP-1 with the CGM, and GLP-1 with Dexcom CGM. And we found that Dexcom GLP-1 group had the greatest A1C reduction across the 3 cohorts. And we were able to publish this in the American Journal of Managed Care Pharmacy and did a reanalysis of it to get published. But what this means for the future is, after the person, an individual with diabetes gets prescribed metformin, metformin's not working, the next step is usually a GLP-1 or an SGL2, and the synergy between the CGM and GLP-1 therapy, and that evidence is building, is trying to show for the indication of type 2 diabetes, it makes sense. Not only are GLP-1s effective alone, but with the CGM, you can get a way greater A1C reduction. And that literature is starting to accrue pretty rapidly, so keep an eye out for that. As far as trends in coverage, nationally, 98% of patients have coverage for Dexcom CGM. This says 2 of the 3 largest PBMs are now covering Dexcom for patients. I'm happy to say that it's now 3 out of 3, so Optum, CVS Health, or CVS Caremark, and Express Scripts all cover Dexcom G7 and G6 on their national preferred formularies for all types of diabetes, not just those taking insulin. This also includes those who are taking oral medications. There is no manual PA. If there is a PA, it's a point-of-sale edit, probably a look back for a diabetes medication claim or a diagnosis of diabetes. And then lastly, 3/4 of Medicare Advantage patients pay 0 at the pharmacy. So the coverage trends are starting to open up. The national PBMs have opened up their coverage on their preferred formularies. Regional health plans are starting to open up that too. And that 98% number includes medical and pharmacy benefits. So if your pharmacy's also billing the medical benefit on Part B, or you're billing the pharmacy benefit, chances are they have coverage for the CGM. And lastly, I wanted to leave you all with this. If you want to write this website down, cgmonitoring.net/pharmacist. We have sponsored pharmacist toolkits, patient education handouts, training videos on our pharmacy webpage. Plenty of great resources to empower you to counsel patients, how to put the CGM on, what to look for as far as the apps are concerned. And then also on that page, we have a clinic workflow resource. So if you do run outpatient diabetes clinics, or if you're thinking about starting one, we have plenty of resources there for you to use. And we also have a hospital discharge guide for folks who get discharged with a CGM and may end up at your pharmacy and looking for more information or more guidance on how to use it. So please go here to find those resources, or you can go to dexcom.com, and we have plenty of resources there for patients and healthcare providers. So with that said, thank you all for your time and sitting through this. I hope I kept it moving, and appreciate it. Thank you.
Can you hear me? At this time, we would like to open up for Q&A. Does anyone have any questions?
Just curious why we don't have an indication for ages under 18, if it's the most accurate in pediatrics for the 15-day.
Yeah, so that's a great question. So our current G7 is indicated in pediatrics and also for adults, and then you saw that the 15-day is for adults 18 and over. And we're currently evaluating the pediatric needs for a 15-day sensor. So, but when we were striving to get a 15-day sensor, we were just focused on adults at the time. So pediatric use can still use the 10.5-day for now, and then I think the future, the 15-day will eventually be approved for children, but right now that's still under evaluation. So great question. Thank you.
Anyone else? Any other questions? Oh,
I think there's one over there.
Yeah.
Oh, never mind. I didn't see him.
So when the 15-day becomes available, the regular G7 will still be available too
Yes.
for a limited time? Okay.
Yep.
And do you know, will the 15-day sensor come in government rates as well?
Rates, you said?
Yeah. So,
As far as rates, you might have to talk to some of my colleagues at the table right here.
okay.
They're a little bit more up to speed on rates and that kind of thing. So.
All right.
anyone else? All right. Oh, question right here.
Another question with the 15-day. What about connectivity with the pumps?
Pumps? They'll all be. Are you asking if they'll be integrated with the pumps? They will be. Yeah. Everything will be just mirror the 10.5 day as far as AID systems. So they'll be all integrated with the pumps. So.
So are you planning to take the G6 away, or is it staying on the market for now?
It's staying on the market for now. There'll be updates about the G6 in maybe September. So you can read between the lines there. Yep. So.
Any other questions? All right. Thank you so much for attending, everyone. Thank you, Andrew.
Oh, thank you, Katie.
Great presentation. The Dexcom booth is right behind here if anyone has any additional questions. And there will be another Pharma Talk session starting at 2:30 on the other side of the stage. Thank you, guys.